Hi, so I'm gonna do my thought question number 3 on mental illness. What is normal and what is crazy? Um, I think when it comes to mental illness, normal, if you could say normal, is someone who doesn't deal with a mental illness, something that doesn't affect their day-to-day lives, that you just can't get, like, being sad is something that you can get over, but having depression is something that's way more deeper than that. So I would say normal is just something that doesn't affect you constantly. And yeah, what is crazy? I don't think anything is crazy. Having a mental illness is something that no one asks for. No one asks to have ADHD. No one asks to have to be depressed. No one asks for these kind of things. So I don't think anything is crazy. Just some things just happen, and you just have these illnesses. It happens. How do you define mental illness? I define mental illness as something that affects your day-to-day life and that normal people wouldn't have to deal with. What can we do to reduce the stigma of mental illness? I think it's really important to let people know that you deal with something, like you're dealing with something that's underneath the surface that people can't physically see. If we talk about it more, if we tell our friends more, we tell our family more, we can reduce this taboo topic that people look to as something that isn't real just because you can't see it. Should we give meds to treat mental illness? If so, for which ones? Which mental illnesses or which meds? I guess I'll go over both. I think for certain mental illnesses you should give, or if the patient wants and could benefit from, they should have meds. With depression, you have antidepressants, and sometimes that works and really helps people, and then sometimes it doesn't. I feel like sometimes though meds just kind of mask the problem instead of bringing it to light. With me, with my meds, they never worked for me. They were, I don't know, they just didn't do anything for me. I was still having a lot of anxiety, social anxiety, and general anxiety about everything, and they just didn't help. What helped was the therapy. For what age should we do meds? An age where they can be compliant. I don't know if when you're 10 years old and you have ADHD, if you should be getting meds. I think people should look for coping mechanisms that could help someone progress without medications. How do you feel about meds versus therapy? I said earlier, I think therapy is way more successful than medications, because then at that point, for mental illnesses that are deep-rooted, like anxiety and depression, you can really get to the problem of, and for ADHD, with therapy, people can learn how to not control it, but kind of control it to an extent of they know how to deal with what they're feeling. Do we overdiagnose mental illness and explain? I don't think so. I think we actually underdiagnose mental illness. A lot of people go throughout their life having these problems and these things going on in their head that they just don't understand, and because of the taboo-ness that's around mental illness, they don't think that there's something out there that could be causing it and that could explain everything. People are so scared to say that they have a mental illness that they don't want to even look into it. Do we over medicate for mental illness and explain? I don't think so. I don't think we over medicate. It depends. No, I don't think we over medicate. Honestly, it's, if you take medication for your mental illness, then, and it helps, then that's great. And then at that point, medication for you is the right way to go. And yeah, I don't think we over medicate. What are your thoughts about ADHD and its treatments? ADHD, I've had actually a lot of family members who had, a lot of my cousins had ADHD, and I've seen the effects of it and what happens when it's not treated. I think that its treatments are right for its specific, illness. I think that I think people who have ADHD and are actually adamant about about using the treatments that they're given, then they can be successful. They can be successful of not overcoming this issue, but controlling it more and understanding it more. Yep. Thanks.